If you receive health care in the Northeast, you may be more likely to undergo medical tests that you don't need. That's according to a new study out of New York University. Researchers surveyed patients with low-risk breast and prostate cancer and found that on average more than 40% of them received imaging tests that were expensive and unnecessary, and the figure was higher in the Northeast than elsewhere. Dr. Daniil Makarov, the study's lead investigator, says imaging rarely proved useful for patients with those types of cancer.
Not only are you paying for the initial test, not only is a patient wasting his or her time to go to the initial test, but it's almost certain not to yield anything that's going to affect how you're ultimately going to treat the patient.
Imaging for breast and prostate cancer involves scanning for other types of cancers that may have spread in the body. Researchers say the practice is widely overused but difficult to phase out. Makarov says the connection between where you live and what kind of treatment you receive is a strong one. He says practice norms and medical culture may account for regional differences in the use of imaging, but the issue needs further investigation.
I don't think it's physicians sitting around and thinking about how they can do something wrong or how they can do extra imaging. I think if you talk to a lot of these physicians, they don't know that they're doing anything different from anyone else because they're just doing what they always do.
Makarov says focusing on doctor-patient relationships alone won't solve the problem. He says policymakers need to take a deeper look at how regional factors affect healthcare. For New York News Connection, I'm Derek Hawkins.